We'll talk about the Billiary System and gallstones here. So here's the biliary tree. You've seen this before as the anatomy of the liver, but it's also the biliary system in it. And so you can see they start at these bile canaliculi that then expand into the intralobular bile ductules, and then these come down and form the left and right hepatic ducts that then coalesce into the common hepatic duct that passes the cystic duct of the gallbladder, and then um, this becomes the common bile duct, and then you have the pancreatic duct joining with the common bile duct, and at the end you have the ampulla vata containing the sphincter of Oddi that regulates flow. So this slide summarizes what I just basically said, so you can read that in your own time. And here's a closer look at the ultrastructure of the biliary system. So you have these bile canaliculi, these sort of areas where the bile sort of flows through, and these then join together to form a bile ductule, and then these will flow into the bile duct. And you can see surrounding all these things then are hepatocytes. So one of the problems that can occur with the biliary system is the production of gallstones. You have cholelithiasis, which is gallstones in the gallbladder, and then choledocholithiasis, which is gallstones in the bile ducts. And it's the most common disorder related to the gallbladder. Gallstones are present within the gallbladder of over 20 million people in the US. Most of them are asymptomatic, but symptomatic stones can occur, and the gallbladder should be removed with persistence and recurrence of symptoms, etc. This table summarizes some of the things that can happen from gallstones. So a buildup of cholelithiasis can cause calcification of the gallbladder, leading to inflammation, and actually the inflammation of the wall can create fistulae, and the gallbladder can leak, giving you peritonitis. This can also occur if the duct leaving the gallbladder is blocked. The gallbladder can rupture and cause problems with inflammation of the peritoneal cavity. You you can also get blockage down the common bile duct, and this can result in pain, pancreatitis, and obstructive jaundice. You can also get a stone down at the sphincter of Oddi blocking there, and this can cause both acute and chronic pancreatitis. And then sometimes these gallstones can get into the small intestine themselves and go down, and then can block the ileocecal valve, which is a narrow opening, and this is called gallstone ileus, and there's problems then of backup in the small intestine. So here we see an endoscopy of someone who's got one of their ducts blocked by a stone. Here down the bottom we see the stone, and then we have this distended bile duct that's sort of full of bile and is expanded as a result. This is a more schematic representation of where stones can form. So they form here, and then they can sort of travel through the biliary system, getting blocked in the bile duct or down by the sphincter of Oddi. Here's another ultrasound showing a gallstone in the gallbladder, and then this is a gallbladder that's full of stones. So this condition if not alleviated, can result in multiple stones in the gallbladder and multiple stones then in the biliary system. Some of these can be moved. This is a gallstone that's been removed with endoscopy and what's called a basket device. So the things that create gallstones, obviously bile secretion is the main digestive absorption function of the liver, and the components of bile are shown here. The ones that contribute to stone formation are the bile pigments, i.e. bilirubin and cholesterol. And that makes sort of three different types of gallstones. You have gallstones that are created purely by cholesterol, and they're the most common. Then you have bile pigment gallstones, which is mainly formed by unconjugated bilirubin. And then you have mixed stones that are a mixture of both cholesterol and bile pigments. Here is another sort of x-ray of multiple stones in the gallbladder. And then you can cut this gallbladder open, and cholesterol gallstones look like this. They're sort of a pale stone compared to the pigmented ones. Here is a cholesterol gallstones with cholesterolosis, and this is where the cholesterol is kind of crystallized along the side of the gallbladder. Here are pigment stones. You can see they're much darker than the cholesterol stones because of the pigments that make them. And then you can have mixed stones, which are pale in areas and then darker in others. And then here we see mixed stones, the cholesterol stones in amongst the much darker bile pigments. So there's the factors that are involved in cholesterol stone formation we're going to talk about here. Basically, cholesterol is very insoluble, and it is maintained in the solution of micelles. But at some point, the concentration of cholesterol can be too much, and it can yield out starting stone formation. But also stasis of the gallbladder, if it's inactive for too long, can cause crystallization of stones. And then you have crystallization promoting factors in bile that can occur as well. So this figure shows the supersaturation of bile with cholesterol. As I mentioned, it's very insoluble in bile and is maintained in a solution of micelles. And in order for the micelles to maintain their integrity, they need to be at a certain percentage of bile salts and cholesterol, that's shown here, essentially low cholesterol percentage and a high bile salt percentage yields this micellular liquid. But as the concentrations of cholesterol and bile salts and lecithin change, then cholesterol crystals can form, and these can start as a nucleus then for stone formation. Obviously, bile is concentrated up to 20-fold in the gallbladder, and so you're more likely to get stone formation in there as the cholesterol concentration rises to a point where crystallization occurs. You can get intrahepatic stones forming, so this is actually in the liver, and the stone is traveled up into one of the hepatic biliary ducts. And this just reiterates some of the points we've talked about. Supersaturation of bile cholesterol was the previous figure. Stasis, reduced motility of the gallbladder, makes stone formation more likely. And then there are some factors in the bile, lipoproteins, that have been reported as putative crystallization factors, enhancing stone formation. The risk factors of cholesterol gallstones are shown here. Increases with age. Women tend to suffer from gallstones more than men. This is exacerbated in pregnancy, and this is mainly due to the effects of progesterone that relaxes smooth muscle. And obviously, if the smooth muscle of the gallbladder is relaxed, then you get stasis and you can get stone formation as a result. But other things like diet, you're taking in a lot of cholesterol, that can aid with obesity. Drugs, the contraceptive pill is again alluding to progesterone. Acromegaly, treated with a certain drug. The liver cirrhosis or ileal disease, these can all then affect the likelihood of you getting gallstones.